Hello everyone. Today's video is about natural treatments to help support the immune system, and then I'll have sort of a sub-theme of supporting the immune system in the context of someone dealing with an autoimmune condition as well. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So someone had posted a question on one of my videos, fairly lengthy question, so I'm not going to read the whole thing through, but the gist of it was they're dealing with an autoimmune condition. So, concerned about having immunosuppression from some of the medications or treatments they're working with, but then how do they also support their immune system at the same time so that they're not getting frequent infections with colds and flus and maybe more serious things. And then they had mentioned a couple of things that they were going to be working with, like bovine colostrum, and they mentioned they're using nasal sprays and things like that. So, I'm gonna take a crack at this question, and hopefully I cover all the things that they're hoping to get. But if not, just post in the comment section, and I will do my best to answer another time. So, when it comes to supporting our immune systems, to be perfectly frank. A lot of the immune system supports that I recommend for my patients when we're trying to prevent colds and flus or treat them more efficiently when they're afoot, or if they were dealing with other infections like, say, like a shingles outbreak or a cold sore or something like that, a lot of the agents that we use aren't actually immune system boosters. They are things that help to support the immune system. I call them immune supports, but I don't really recommend things for my patients that are immune boosters per se. A lot of them are really more like an immune modulator. And modulator, it's just a wonderful term. I love modulators, immune modulators, hormone modulators. Like, they're just kind of the best of both worlds because they don't overdo it in any one direction. They just help to balance things, is the way it plays out in clinical practice, and that's what the research literature, such as it exists, helps to support that. That's what they do as well. So, for example, if patients of mine are dealing with, say they're really prone to getting chest infections. Like I was talking to a patient earlier this week, and really lovely patient. They're very good people, health conscious, but unfortunately having trouble kicking a cigarette addiction. And so this individual, when they get sick, it's harder to shake the infection. It can go to their chest more easily because, of course, cigarettes are just really bad for us and really bad for our lung health, unfortunately. And so with this individual, they do so much better when they take N-acetylcysteine, NAC, and I recommend NAC for my patients all the time when they're either prone to having infections go into their chest, or they're dealing with a chest infection and they just can't seem to clear it, or they have a persisting cough. It's like, oh, I was sick like a month ago, and I cleared the infection within say 3 to 7 days, but I still have this persisting cough. NAC can be really helpful in those scenarios, in my experience. So NAC can be great in those examples, but it's not an immune booster. It's really an immunomodulator. So it helps to downregulate pro-inflammatory pathways, which is something we'd want in autoimmune conditions, but it doesn't boost up antibody levels or boost up some element of the immune system that might actually exacerbate autoimmunity. So a lot of the natural agents that we use for immune supports fit into that category. Another example would be zinc. We take zinc because it's like, oh, I'm going to take that to boost my immune system if I'm fighting an infection. And yes, we do need zinc for our white blood cells to function properly, but to my understanding, zinc doesn't particularly boost up antibody levels or in some way exacerbate autoimmune conditions. I've never seen it cause those issues at all. So the same is true of a number of other agents, like, for example, the herb Chinese skullcap, great antiviral, good immunomodulator, not an immune system booster. Now you can get into a little bit more of a gray zone where certain herbs, like, for example, astragalus root. Astragalus root is a common thing that people take, a common compound, a common herb that people take to help their immune systems, and it's in a lot of immune system support formulas. Now, astragalus, to my understanding, it can boost up our Th1 antibodies, and so our Th1 like helper cells. And so those Th1 cells, if we increase them too much, that could potentially exacerbate autoimmunity. Now, in clinical practice, I don't really find that ever happens. I have patients who come in, they have autoimmune conditions, they're taking astragalus, never actually seen a problem. It's, to my understanding, really more like the Th17 cells. We don't want to work with things that are going to boost those up, but astragalus would be something that I would personally just use more caution with when I was advising my patients who are dealing with autoimmune conditions. So I wouldn't intentionally prescribe it to them, but if they came in and they were already on it and they said, hey, this is working well, I've been on it for years, or I've been using it on and off for years, I've never had a problem, I wouldn't be saying to them, oh my gosh, you've been playing with fire, you should really, really stop this. So I wouldn't initiate it because there's just other things I can use instead with my patients that don't have an impact on Th1 that we know of, but a lot of these natural agents tend to be really quite safe, so we don't have to really tiptoe maybe as much as one might think, as long as we're putting our thinking caps on and knowing about the background sort of biochemical pathways, molecular biology pathways that are going to be impacted by these different agents. The individual who had posted the question had mentioned that they were using some kind of nasal spray. I can't remember. Oh, they said they were using propolis, and then weren't sure about what form was the best to take. I have used propolis diffusers before. Don't know if I've ever used a propolis. I don't think I've ever used propolis in a nebulizer before. I know some individuals do. I don't really have a lot of experience with propolis. My understanding is you have to be really careful with propolis because it can potentially be mold contaminated, which is really sad irony because folks will sometimes use propolis to help treat mold because it has anti-mold properties to it. So I have a lot more experience using frankincense, like diluted frankincense, essential oil, nasal spray, and throat spray, or nebulized essential oils like thyme. Those are the things that I have more experience with. But I just had a patient earlier today with an autoimmune condition, and we were talking about things that she could work with to help support her immune system because she was worried about getting sick because it's cold flu season. She's on an immunosuppressant. And so we talked about using frankincense nasal spray and throat spray because, again, those things are not going to boost the immune system. They are anti-inflammatory, they're antimicrobial, but they're not going to boost the immune system. So nasal spray and throat spray can be a really great adjunct. The one thing that the individual mentioned in this email was, in this comment on YouTube was taking bovine colostrum. I think it was bovine colostrum. Maybe it was serum bovine IgG, but anyways, one of these cow-based antibody formulas. And so with those, it's like, oh, we're taking IgG, or we're taking like serum immunoglobulins that are available, not available in Canada, but available in the States over the counter. And I said, well, maybe that's going to be playing with fire a little bit more with an autoimmune condition. To my understanding, using colostrum or using serum immunoglobulins, also not something that's going to exacerbate autoimmune conditions, because these immunoglobulins are really, it's kind of like, why are they there in the colostrum in the first place? What is colostrum? Colostrum is, of course, the first milk that's produced by a mammal postpartum, like after giving birth, and it's just it's extra rich in nutrients and extra rich in antibodies because that newborn baby mammal does not have a formed immune system, so they're reliant on mom's breast milk to fight off infection in those first days of life when they're first developing their immune system. And so those antibodies, to my understanding, are they are non-specific antibodies. They don't have the ability to they don't get converted into autoimmune antibodies. They're going to help to fight off infection, but they're not going to somehow get morphed into like, oh, there's that anti-joint antibody, that anti-nerve antibody, that anti-skin antibody, what have you. So that's something where it's kind of more of like almost like an artificial extra immune system support, again, but not like going to specifically boost up those autoantibodies. To my understanding, the main things that are going to drive or exacerbate autoantibody levels are things that are going to drive and exacerbate a lot of inflammation. And all the things that I have mentioned all have an immunomodulating effect / some of them just a frank anti-inflammatory effect. So it is something where, as I said at the beginning of the video, this is not medical advice. You should definitely talk to your healthcare provider to get advice about what to take, especially if one has an autoimmune condition, because the stakes are higher for misstepping if you take the wrong thing. But I don't think that it's a topic that has to be shrouded in quite as much, like fear of misstepping as one might have originally expected. So I hope with this video there's been a little bit of something for everyone. If you don't mind, please taking a quick moment to please like, share, subscribe, and or post a quick comment on the video. I would really appreciate it. So thanks in advance for taking a second to do that. I'm just hoping that the content is applicable for folks with autoimmune conditions and learning a little bit more about things that can be used to support the immune system, but then also folks who are dealing with an autoimmune disease, then hopefully this has been valuable for you too. If you have any questions or comments on this topic or anything else, just post in the comment section below, and I will do my best to answer as soon as I can.